Today's research update will look at the strategic use of electrolytes, especially in young calves. This information was presented at the 2020 American Association of Bovine Practitioners Conference that was held in September of 2020 and presented by Dr. Andrew Lear, who's at the University of Tennessee. An electrolyte basically is a fluid that is given to calves and cows in some cases that are suffering from dehydration. So we're trying to replace lost fluids along with electrolytes and some source of nutrients for that animal as well. The focus on calves, things to look for severe dehydration, including the sinking of the eyes back into the head of the animal, pinching of the skin resulting in tenting that does not snap back quickly. In some cases, the inability of the calf to stand, a dull appearance. Most of these animals will show signs of excessive diarrhea and looseness in feces. They may not want to suckle or drink off a nipple here, and if not treated properly, these animals will die from secondary causes. She looked at basically three methods of administrating electrolytes. The first one is oral electrolytes, where the calf will suckle or drink the product. We will recommend adding one extra, if not two extra feedings, along with the fluid milk or milk replacer, normally following 2 to 3 to 4 hours after consumption of those products. We want to make sure we keep the calf on some milk and milk replacer as a source of energy and to run the immune system. A second approach is to use subcutaneous. That means placing it underneath the skin. It will take 1 or 2 hours for it to be absorbed, and this is for, again, calves that are not seriously ill. The third approach is intravenously, which means we are putting it into the vein of the animal, and these are usually calves that are down and showing severe signs of diarrhea and perhaps shock. It should be administered over 2 to 6 hours length in duration. Therefore, that adds to the cost, especially if it's administered by a veterinarian, and the labor and time it takes to do this. Once the calf starts to recovery, she can then be switched to an oral treatment. So our take-home message is primarily that early intervention is important. To use a good product that has proper osmolality, usually some type of an acidifier here or alkalizer, such as sodium bicarbonate, acetate, or propionate. And in some cases, we will also IV a dextrose solution or give the calf a dextrose bolus. Thanks. That completes our program for today. Have a good day.